Traditional Chinese medicine has used rhubarb for thousands of years as a remedy for gut disorders, liver and kidney disease, poisoning, and more. It's been used in traditional Chinese medicine since the 3rd millennium BC. It was traditionally used to heal a wide variety of issues like constipation, fever, inflammation, and kidney failure. It may help with liver and kidney disease. It relieves menopausal symptoms and menstrual pain. It boosts the gut health. It helps with sepsis and pesticide poisoning. It can support stroke recovery, and it might lower cholesterol and blood pressure. It contains toxic compounds known as salts of oxalic acids or oxalates, and these are not broken down during the cooking. These compounds are highly concentrated in the leaves, so these should not be consumed. Other anthraquinone compounds such as aloamodin, amodin, and rheolin have antibacterial properties, and these work by disrupting the cell membrane of bacteria and their protein and energy production. They also act as laxatives. In a clinical trial on 232 people, a Chinese herbal medicine that contained rhubarb was used to treat non-alcoholic fatty liver disease, and it reduced the ALT levels, which are a marker of the damage. For infantile cholestatic hepatitis, which is a rare genetic disorder that causes the bile buildup in the liver of newborns, rhubarb was 89% effective at reducing jaundice, the yellow pigmentation of the skin that indicates the bile buildup in 64 infants. The rhubarb has the potential to boost liver function, reduce fatty liver, and improve bile flow alongside the conventional treatments. In people with chronic kidney failure, the level of blood urea nitrogen, or BUN, and creatinine are often high, as the kidneys struggle to eliminate the waste products from the blood. Supplementing with 1 gram per day of rhubarb normalized the levels of the BUN, the creatinine, and the other waste products in 48 patients. Another Chinese herbal combination with rhubarb slowed the progression of chronic kidney failure in a clinical trial on 30 people. It was effective both alone and in combination with a drug for high blood pressure, Capotril. Combined with dialysis, a Chinese medication with rhubarb reduced the buildup of toxins in the blood. It helped to slow the progression of chronic kidney failure in 57 patients. Kidney disease is a common complication of diabetes. In 112 patients, rhubarb containing Chinese herbal mixture with insulin treatment was equally effective as conventional anti-diabetic drugs. In a clinical trial on 32 people with kidney inflammation, a rhubarb containing Chinese herbal remedy added to a steroidal anti-inflammatory drug improved the kidney function better than the drug alone. In a clinical trial on 109 women approaching the menopause, a rhubarb containing supplement improved the quality of life and reduced the symptoms such as the frequency and the severity of hot flashes. Importantly, the supplement didn't alter the gynecological factors such as uterus health or bleeding. According to a meta-analysis of 16 clinical trials with over 900 people, rhubarb used as a standard treatment is effective and safe for reducing pancreatic inflammation. In a clinical trial on 126 people with severe inflammation of the pancreas, the use of the Chinese rhubarb powder at 15 grams once or twice per day with a specific nutrition plan lowered inflammation, disease severity, and liver and kidney damage. A meta-analysis of 12 studies concluded Chinese rhubarb has a beneficial effect on people with pesticide poisoning. Chinese rhubarb combined with mineral powder and blood purification was more effective at treating severe herbicide poisoning than a standard treatment. In a clinical trial on 30 people, Chinese rhubarb at 10 grams per day added to the normal treatment improved gut function. In another trial on 89 critically ill children, a Chinese herbal remedy that contained the rhubarb added to the conventional drugs successfully reduced the gut dysfunction. Syrian rhubarb syrup at 2.5 to 5 ml per day, along with an antibiotic reduced fever, diarrhea, and the duration of stomach pain in a clinical trial on 150 children with intestinal infections. It also reduced the need for the anti-fever medication. Chinese rhubarb helped to stop digestive tract bleeding in a study of 312 hospitalized patients. In a clinical trial on 60 people with digestive tract bleeding and fever, taking Chinese ground rhubarb at 3 grams 3 to 4 times per day with ground Chinese ginseng boosted the recovery. In a clinical trial on 360 people, a Chinese herbal concoction that contained the rhubarb helped people undergoing gallbladder removal surgery recover the gut functionality more quickly. It also reduced the length of their hospital stay and their need for IV fluids better than just the antibiotics. In a meta-analysis of 15 clinical trials with 869 patients, rhubarb powder in combination with a standard treatment improved gut dysfunction, inflammatory markers and platelet count, but did not reduce mortality. In a study with over 1,000 patients with sepsis, Chinese rhubarb reduced fungal infections, especially when combined with adequate nutrition. Similarly, 50 milliliters 3 times per day of a Chinese herbal concoction that contained rhubarb, when used with conventional medication, decreased levels of inflammatory agents, interleukin-6, interleukin-10, and TNF-alpha, in a clinical trial on 45 people with sepsis. A meta-analysis of 27 animal studies determined the Chinese rhubarb can help to reduce organ damage from blood poisoning. Consuming 27 grams a day of ground rhubarb stalks reduced the total in LDL cholesterol by 8 to 9% in 10 men. A Chinese herbal formula with rhubarb was effective as a standard drug at reducing both the systolic and diastolic blood pressure. Systemic inflammatory response syndrome, or SIRS, causes widespread inflammation. In 78 people with SIRS, Chinese rhubarb powder added to the conventional treatment helped to cure the disease, and it reduced the organ damage and death. It possibly acted by lowering the inflammatory substances like the TNF-alpha and C reactive protein. Similarly, Chinese rhubarb extract at 15 to 20 grams twice a day via an enema or through a stomach tube reduced the levels of pro-inflammatory substances in 57 SIRS patients. In a meta-analysis of studies with nearly 1,000 participants, Chinese herbal mixtures containing rhubarb, in addition to conventional medication, help patients recover from strokes by reducing the severity of their post-stroke symptoms. Chinese rhubarb extract at 5% was moderately effective at speeding the healing from recurring mouth ulcers in a clinical trial on 125 people. In 145 patients, a sage and Chinese rhubarb 23 mg topical cream had a similar effect as common herpes medication Zvirex for treating herpes sores. Acute respiratory distress syndrome, or ARDS, causes serious lung inflammation. In a clinical trial on 80 people with the disease, 30 grams per day of Chinese rhubarb was able to reduce the fluid buildup in the lungs. In a clinical trial on 45 women, Himalayan rhubarb at 1,260 milligrams twice per day was equally effective at reducing menstrual pain as the painkiller mefanic acid. Radiotherapy for lung cancer can cause severe adverse effects. In a clinical trial on 80 people, 20 milligrams per kg of rhubarb reduced the incidence of lung toxicity, improved the lung function, and reduced levels of inflammatory substances. Chinese rhubarb improved memory and had antioxidant effects in senile people. A traditional Chinese herbal remedy that contains rhubarb helped to decrease body weight and insulin resistance in a clinical trial in 140 obese people. Similarly, it reduced waist circumference in a clinical trial on 240 people with high blood pressure. The anthraquinones in the rhubarb have antibacterial properties. One such compound, amodin, is effective against Staphylococcus aureus, even antibiotic-resistant strains. the bacteria that cause staph infections. In rats, the rhubarb extract cleared an infection of Helicobacter pylori, the bacteria that causes ulcers. The extracts were effective against resistant strains also. Rhubarb rhizome and root is likely safe when taken in amounts present in food. Possible side effects can include diarrhea, high liver enzymes, skin rash, changes in urine colour. Pregnant women should avoid the herb in all forms due to its potent laxative effect. Because rhubarb has a strong laxative effect, you should discuss this with your doctor before combining it with any medication, especially medication for heart failure. The dose for rhubarb can widely vary. Clinical trials use doses ranging from 50 mg to 50 grams per day. Rhubarb has been used for centuries and is especially important in traditional Chinese medicine. It considers it to be a vital remedy for various diseases. Studies show it has numerous benefits that range from gut, liver and kidney protection to lowering inflammation and cholesterol. Chinese rhubarb is often combined with other herbs and dietary changes to achieve a synergistic effect in traditional Chinese medicine. Common rhubarb might relieve menstrual pain and menopausal symptoms. The part of the rhubarb medicinally used is the rhizome and the roots. They're generally very safe and cause few side effects. To learn more about herbs, supplements and natural treatment plans, check out my website.